is Ellinor Goergen. I am a study physician at the German CLL study group and resident physician in hematology and oncology in Cologne in Germany. We did an evaluation of the patient-reported quality of life outcomes in the CLL12 study, which basically evaluated patients with a low or with a high risk of transmission or of progression of CLL, but they were all treatment naive and all asymptomatic, being A stage patients. So what we did there is we had two or three groups, and two groups were placebo and the ibrutinib group. And in these groups, we evaluated the quality of life through regular questionnaire setups. So we, in the CLL12, we know that we saw there's no overall survival benefit in the asymptomatic early stage patients. So we found it even more important to assess the quality of life in these patients as one of the main assets. Interestingly, we found results that were not totally clear from the beginning. So we did see that the ibrutinib treated group and the placebo treated group had similar baseline values of global health score. We also saw that in both groups, the global health score and the physical functioning in these groups was rising. So also in the placebo group, we saw an improvement of physical functioning. Then we looked at time or clinically important differences. So the time to deterioration in symptoms and also in the physical functioning, and times to improvement. So in the symptom scales, we looked at especially at the ibrutinib-associated toxicity. We saw that there was minimal difference between the two groups, especially in the bruising. So we saw a shorter time to deterioration in the ibrutinib group and bruising. In other ibrutinib-associated toxicities, like skin problems or diarrhea, we did not see a difference, interestingly. In the functioning scales, so like global health score and physical functioning, we did see a difference in time to improvement in the ibrutinib group. So compared to the placebo group, the ibrutinib group had a quicker improvement of physical functioning. So these were basically the most important findings. So what we can conclude from these findings is that we do not see a major impact of ibrutinib in these asymptomatic early stage CLL patients. Also, we do not see a negative impact of it, which is also a very important finding. Since we know that, the basic assessment when we see a patient is, how are you feeling, right? So what we think is very important is in those patients that are asymptomatic to rule out a progression of CLL. And this is basically the first thing that you have to do, how are the patients feeling? If they're not feeling good, what is the reason for it? So this is probably the quick summary of the quality of life that you do every day or that nurses do every day. I guess it is very important to look at the factors that can lead to target a progression of CLL. So patients feeling fatigue or feeling overwhelmed by the disease or by the implications that it has on their everyday life. What we are trying to do in this, basically in the manuscript that we want to publish on this abstract, is to match the actual quality of life outcomes that we receive from the patients with the events. So also with the efficacy and with the safety of the drug or of the overall trial, which will probably be very interesting to see if our quality of or the patient-reported quality of life outcomes actually match the events we saw in the study. This is basically what we're trying to do in the near future.